Brooke from Legacy Physical Therapy, back again to talk about some of the common signs of pelvic floor dysfunction. We've already talked about bladder signs and bowel signs, and in this video we will be talking about common pain issues that can be a sign of pelvic floor dysfunction. So we already talked a little bit about it in the bladder video, where we discussed that pain with a bladder pain with a full bladder or pain with urination, it could be a sign of pelvic floor dysfunction. Definitely need to rule out a urinary tract infection first, but that type of pain should not be happening. Another area where women commonly experience pain is pain with any type of vaginal penetration, such as pain with intercourse, tampon use, or gynecological examination. Although none of us wake up in the morning and wish for a gynecological examination, they should not be painful experiences. So if you are experiencing pain with any of those situations, working with a pelvic physical therapist can be very helpful to try and assess what's going on with the pelvic floor and get it heading back in the right direction. Commonly, the pelvic floor muscles might be too tight, not relaxing the way that they need to be. There might be some scar tissue in the area, especially if you're postpartum and had a vaginal delivery or episiotomy scar, or scarring from tearing from that vaginal delivery might be causing some of the pain, and working to improve that scar tissue mobility can make a huge difference. So again, if you're dealing with pain with intercourse, pain with tampon use, or pain with gynecological examination, that you should not be happening, and there's conservative treatment options that you can do to make this feel better. So please seek treatment for that. Another area of pain that people may not be aware of, that maybe a pelvic floor muscles might be a cause for, is low back pain or abdominal pain. So I work with many patients who have been dealing with long-term low back pain, and they've tried lots of different treatments and they're not getting better. And it's because no one's ever evaluated their pelvic floor muscles. Our pelvic floor muscles are part of our core support system. They work all day with our deep abdominal muscles, deep back muscles, and our diaphragm to help regulate pressure in the intra-abdominal cavity. And if they're not doing their job, then that puts a lot of strain on the rest of the core support system. So in any of my patients who are dealing with abdominal or low back pain, I am always evaluating and seeing if their pelvic floor might be a source or might be part of the issue. So if that sounds like you, please get your pelvic floor checked out to see if that might be part of the pain that you're experiencing. The last area of pain that is potentially where the pelvic floor might be a potential source for the pain is pelvic pain itself. So pelvic pain really is anything from kind of the belly button to the top of the thighs, so depending on who's talking about it. So we kind of hit on that with the back and the abdominal pain, but a lot of women dealing with pain in the vulvar area, pain in the perineum, whether or not they've had kids, and it can be very chronic in nature. It can limit them from being able to sit comfortably, to wear underwear comfortably, to wear tight-fitting clothing. So it can really affect day-to-day life for many women. And so just to go over everything again on the pain side, you should not be experiencing any pain with intercourse, tampon use, gynecological examination. If you've had long-term low back pain that isn't getting better, your pelvic floor may be a part of it. Pelvic floor muscles definitely may be a part of pelvic pain or abdominal pain themselves. So all of those are signs that you should get checked out, because there's things that you can do. And stay tuned for our next video, where we'll be talking about some prolapse issues and how that may be related to pelvic floor dysfunction.